Hi to all of you. Today we are going to see another topic in diabetes mellitus about the management of diabetes mellitus. I am Dr. Divya Joyce. So before we start talking about what are the treatment options available for diabetes mellitus, we'll talk about the diagnostic criteria when we decide to treat patients as diabetic patients and when we decide to start treatment for diabetic individuals. So first, how do we diagnose diabetes mellitus? Based on ADA criteria, American Diabetes Association criteria. So what are the parameters used? One is the fasting plasma glucose or the fasting blood sugar as we call it in India, the postprandial blood sugar PPBS, HbA1c or glycated hemoglobin, and the other one is RBS, which is random blood sugar. So first we'll see how we diagnose based on fasting blood sugar. If a patient comes to us with a fasting blood sugar of more than or equal to 126 mg per deciliter, we can consider them as a diabetic, or this should be after 10 hours of fasting. Okay, so after 8 to 10 hours of fasting, that is why after an overnight fast we do a fasting blood sugar. If they are having a blood glucose of more than or equal to 126 mg per deciliter, we can think that they are a diabetic and decide to start treatment for them. Postprandial blood sugar, if it is more than or equal to 180 mg per deciliter, and what does this postprandial mean? Here I told you fasting means after 8 to 10 hours of overnight fast. This postprandial blood sugar, like it is done routinely in all laboratories, is not just 2 hours after a normal diet. It is something which should be done after an oral glucose tolerance test. So, patient for the past 3 days before he is planning to take up a blood test should have an unrestricted carbohydrate diet containing at least 150 gram of carbohydrate per day. For 3 days he takes this kind of a diet. And then after that, he observes a fast of 10 hours to 16 hours, comes to us in the morning, and we give them a glucose load, oral glucose tolerance test. So we are going to check their tolerance to glucose. We are going to give them 75 gram of anhydrous glucose, and this 75 gram of anhydrous glucose should be mixed in 150 to 300 ml of water. So when we give them this solution, we should wait for 2 hours and then we should check the blood sugar value. This blood sugar value is what we call as a postprandial blood sugar value. So this postprandial blood sugar value should be used in diagnosing and deciding treatment necessity for a diabetes mellitus patient. So postprandial blood sugar of more than or equal to 180 mg per deciliter done after an oral glucose tolerance test in this method, or a HbA1c which is more than or equal to 6.5% is diagnostic of diabetes mellitus. Random blood sugar. Do we use random blood sugar to diagnose and treat diabetes mellitus? We can if we have additionally symptoms of hyperglycemia. So if patient is having symptoms of hyperglycemia like polyuria, polydipsia, they are coming to you with some complication of diabetes mellitus, or if they are presenting in acute complications of diabetes mellitus like diabetic ketoacidosis or hyperglycemic hyperosmolar state, and their random blood sugar is more than or equal to 200 mg per deciliter. In such a situation, we can diagnose them as a diabetic. So we have 4 values which is used for diagnosing diabetes mellitus. So today patient comes to me and tells his fasting blood sugar is more than or equal to 126 mg per deciliter. So can I directly go ahead and start test? No. According to guidelines, what has to be done is 2 samples and 1 test, or 2 tests and 1 sample. What do I try to mean this through this is that 2 samples, 1 test. That is, if I am going to use fasting blood sugar to diagnose diabetes in this patient, 2 different samples have to be given. That is, today and maybe tomorrow, I have to take 2 different samples and then start treatment for diabetes mellitus. Or 1 sample, that is, patient is telling you, I have come today for my test, I want to get all my evaluation done today. You will do 2 different tests of these 4 tests. Okay, RBS and symptomatic hyperglycemia cannot be used, either fasting blood sugar, PPBS or HbA1c. 2 of these 3 tests have to be done, say fasting blood sugar and HbA1c. 2 tests I am doing from 1 sample which is taken on 1 day. So either 2 samples of the same test or 2 different tests taken from the same sample are showing this criteria for diagnosing diabetes mellitus, then I can diagnose diabetes mellitus. Based on a single value of fasting blood sugar, I am ideally not supposed to diagnose diabetes mellitus. So this is how we diagnose diabetes mellitus. And another thing which we have to notice is HbA1c. So HbA1c is glycated hemoglobin. So if I am going to have severe anemia, severe blood loss, will my hemoglobin amount be normal? No. So in such a situation, can I use this HbA1c as a diagnostic test? So there are certain situations where you cannot use HbA1c as a diagnostic test. First one is pregnancy. In pregnant individuals, we don't use HbA1c for diagnosis of diabetes mellitus. Patients with HIV, we cannot use HbA1c as a diagnostic test. And another thing I told you, it is based on hemoglobin. So if patient is having a hemoglobin variant, then I cannot use it. Or patient has G6PD deficiency, I cannot use HbA1c. If patient has a recent history of blood transfusion or a recent history of blood loss, in all these situations, I cannot use HbA1c as a diagnostic test. I will have to rely on either fasting blood sugar, postprandial blood sugar, or if they are symptomatic, I can rely on random blood sugar for diagnosing. So routinely, whom do we screen for diabetes mellitus? Any patient coming to me with some symptoms of diabetes mellitus or some disease which is associated with diabetes mellitus, obviously I'll send them for diabetes screening. So if there is no disease which is suggestive of, disease or any symptom suggestive of diabetes mellitus, whom and all should I ask to do these about tests that we discussed about? So patient aged more than or equal to 35 years, then we can routinely screen them every 3 years. If their sugars are normal, we continue screening them every 3 years. This is what can be done. People who are less than 35 years, when do we screen them? If they have some risk factors. So what are these risk factors that we are going to use to decide whether this patient needs screening for diabetes mellitus or not? First one is, you would have learned and we have discussed in the etiopathogenesis that it is something which is associated with genetics. So patient has a first degree family relative who is a diabetic. Then patient needs screening before 35 years of age. Family history of diabetes mellitus. Or patient is having other risk factors like dyslipidemia. Patient is having systemic hypertension. Patient is having some coronary artery disease. Some history of stroke. All these patients I will have to screen for diabetes mellitus. Or in certain situations, patients will have certain genetic disorders which can be associated with diabetes mellitus. Obesity. So such people have to be screened for diabetes mellitus even if they don't have symptoms and even if they are less than 35 years of age. How do we do the screening? By using the same fasting blood sugar, postprandial blood sugar and the HbA1c, we can use the screening test. Whom to screen we have discussed and when to screen. That is, when they are presenting to you in a asymptomatic way, when do we screen them?